Welcome. I am Terry Tropin, and today I'm presenting a discussion of the guidelines for selecting the body part character in building a PCS code from the medical and surgical section. See the video posted on YouTube for an introduction to PCS and digits 1 and 2. Another video discussed root operation digit 3. Future videos will include 5 through 7 that are all necessary to build a PCS code. First, let me introduce myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I am also an AHIMA-approved ICD-10 trainer. I've taught health information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines. My books include One on E&M Coding, ICD-10-CM, ICD-10-PCS, and External Causes. These are all available on Amazon. So character 4 is used for the body part that's involved in the procedure being done. It indicates the specific part of the body system or anatomical site where the procedure was performed. So you have the section, which in this case is 0 for surgical, the body system, the root operation, and then the more specific body part within the body system. So this is what we're going to talk about. General guidelines, tubular body parts with and without their own separate characters, tubular body parts, multiple procedures, and multiple body parts. Then we're going to talk about guidelines related to specific body systems, heart and great vessels, upper bones, upper joints, lower joints, tendons, ligaments, and bursas, and skin, subcutaneous tissue, and fascia, and the gastrointestinal system. Finally, we're going to talk about guidelines related to specific root operation, like bypass. First, let's talk about the general guidelines. Some body part values include the word and. And, according to the guidelines, means and or. For example, in the lower arm and wrist muscle, right, body part character B in the muscles section K, this means lower right arm only, lower right wrist only, or both lower right arm and wrist. Here's an exception to this rule. In the female reproductive system, there are separate values for vagina and cul-de-sac, and cul-de-sac. So here's the cul-de-sac, and here's the vagina. So in order to use H, vagina and cul-de-sac, you have to have involved vagina and cul-de-sac. Otherwise, you do separate digits, either G or F as appropriate. There are other examples of this exception. See male reproductive system spermatic cord, epididymis, and epididymis and spermatic cord. Again, don't use the value for epididymis and spermatic cord unless both tissues are involved in the surgery. Sometimes documentation from the provider will use the prefix peri. The guidelines state that the peri prefix should be ignored. Use the body part referred to by the rest of the term. For example, a procedure site was described as perirenal. Use the character for kidney. Unfortunately, there are also exceptions to this too. For periosteum, use the body part for appropriate bone. The procedure site may, for example, the procedure site may say periurethral, but the documentation may indicate that it's the vulvar tissue that's being treated. In this case, use the body part system for vulva in the female reproductive system, not urethral opening in the urinary system. Also code guidelines for bilateral procedures. Some body systems include values for right, left, and bilateral for body parts, but others do not. If a body part value for bilateral exists, then use the value for the body part, not separate values for right and left. So for example, there are body part values for ovary right, ovary left, and ovaries bilateral. In this case, you would use the body part value for 2 for bilateral, not 1 for right and 1 for left. On the other hand, sometimes there is not a bilateral body part value to choose from. In this case, report 2 codes, 1 for right and 1 for left. For example, there's no bilateral character for tendons of the hand. If the same procedure was done on the right hand and the left hand, you're going to use 2 codes, 1 for right, body part value 7, and 1 for body part value 8 for left. So here's a practice question. If you wish, you can pause the video to look up the answer on your own. Bilateral excision of fallopian tube, 0UB, the first 3 letters, digits, female reproductive system excision. The body part character is 5 fallopian tube right, 6 left, 5 and 6 right and left, meaning you would use 2 codes, or 7 bilateral. Since there's a body part character for bilateral, you're only going to report 1 code, and that's 7. It would be incorrect to do 2 separate codes using 5 and 6. Here's another practice. Extracorporeal shockwave lithotripsy of stones in the right and left ureters. 02F, urinary system fragmentation. The body part characters used are 4, kidney pelvis, 6 and 7, ureter right and left, 7 left, 6 right. In this case, there's no body part value for bilateral, so you would do 2 codes, one with using a 6 body part value and one using a 7 body part value. Some body parts are divided into several different values. For example, the thyroid includes a different value for left lobe, right lobe, isthmus, and just the thyroid gland as a whole. So what you're going to do is use the most specific body part available. If the documentation says left lobe, use that G. That's much more specific than using K, which is just thyroid gland. Some body parts have a great number of separate characters. Here are only some of the values that are available for the intestines. 0, 8, 9, A, B, D, E, F, G, H, K, L, and this is only some of them. If a subdivision of a body part has its own characters and all of that part is cut out or off, code as a resection. Remember, resection is removal of all. You would not use excision, removal of part, with the body part for the whole body, the whole part. For example, if you're using thyroid lobes and isthmus, lobes of the lungs, lobes of the liver, region of the intestine. And here's an example. Removal of all of the right lobe of the liver. You would use resection, removal of all, with body part value for right lobe. You would not use excision, removal of part, with the value for liver. This one is much more specific, right lobe rather than liver as a whole. The previous slides discuss circumstances when a single body part has multiple possible values. Sometimes a procedure is performed on a portion of a body part, but that portion does not have its own value. The guidelines state that in this case, use the value for the whole body part. So for an example, a procedure was performed on the alveolar process here of the mandible, the jaw. Since there's no body part value for alveolar process, you're going to use the body part value for the mandible. Sometimes the procedure is performed on a branch of a body part, but that branch does not have its own value. The guidelines state you should use the nearest branch that does not have a value, that does have a value, sorry. So in this case, you have a mandibular branch, which is a branch of the trigeminal nerve. There's no specific body part value for the mandibular branch, so you use one for the trigeminal nerve, which in this case, the body part value K. In most cases, you use the value for the nearest proximal branch that does have a specific body part, except, here's some exceptions, and here's where this is in your guidelines if you want to give another look for it. Sometimes the nearest branch is in a different body system. In this case, use the code in the correct body system. And here's an example coming up. So occlusion of bronchial artery. Here's the bronchial artery. This is in the upper arteries section, but it's closest to the thoracic aorta, but that's in the heart and great vessels. So you're not going to code to heart and great vessels, even though it's closer to that. You're going to use a body part value in upper artery body system. Now, some body systems include specific body part values for fingers and toes, but others do not. These body systems do not have separate characters for fingers and toes, but do have values for feet and hands. Upper veins, lower veins, skin and breast, subcutaneous tissue and fascia, muscles, tendons, bursa. So if the injury is to a muscle in the finger, you would have to go to muscle in the hand, since there's no value for finger. Other body systems do have specific body part values for fingers and toes. Upper bones, upper joints, lower joints, anatomical regions, upper and lower extremities. So in this case, you have the fingers are numbered and then there's thumbs. And so you'd be able to use the specific finger or toe to build the code. There are also guidelines for coding tubular body parts. The guidelines state you should code only for the furthest area from the point of entry into the body. So if the endoscope was the rectum to the descending colon, you would only use a value for descending colon. You wouldn't use rectum, sigmoid colon. You'd only use one code for the furthest part examined. Multiple procedures. That concludes the general guidelines. Now we'll discuss other specific guidelines. Multiple procedures. Multiple codes can be reported if there are different root operations on the same body part, different body parts, but same root operation, or in any instance where one of the digits will be different in telling the whole story. So different root operations, same body parts. In this case, two codes are listed with different root operation values but the same body part value. For example, sigmoid colon, destruction of lesion, and bypass. So you would do the bypass procedure and then you'd do a different code for destruction of lesion. Both use the body part value N. There are other exceptions. These are in the root operation guidelines. Those were discussed in the root operations video, but also in guidelines B3.18. So what if it's the same root operation but different body parts? In this case, again, two codes are listed with the root operation value the same, but the body part values different. So excision of liver and pancreas, you're going to list two codes, 0FB0 and 0FBG. And so it's the body part value that will be different. Sometimes other values are different. It's important to remember if different values are needed to fully explain what happened during this surgery, list several codes with the different values. For example, a biopsy is coded as an excision If a biopsy and excision of the left breast is performed, report 2 codes, one with excision B and body part U. The second code will be the same except for that 7th digit. Biopsy is coded with an X. So the 0HBU will be the same, and it'll just be that final digit that is different. A biopsy is coded with the 7th character X for diagnostic. So in order to tell the whole story, you have to have 2 different codes. Now, there are also body part guidelines for specific body systems. For the body system, heart and great vessels, the body part values are numbers of coronary arteries, not the names of the arteries. So for an example, angioplasty of the right coronary artery and the circumflex artery with placement of 2 stents. You're going to list 1 code. It says 2 arteries, coronary artery, 2 arteries, and that's a 1. On the other hand, if there's something else in the codes that make them different, you need to do 2 codes. For example, angioplasty of right coronary and circumflex arteries, same as the last one, but in this case, a stent was placed in the right coronary artery, but not the circumflex artery. In this case, you're going to do dilation of 1 coronary artery with a stent, and then 1 coronary artery without a stent. And in this case, the body part's going to be 0 because you're doing, this refers to 1 coronary artery, this refers to another one. In this case, you're doing 2 arteries. In this case, you're doing 1 artery, 1 artery. And the fact that it's a stent will be picked up in the 6th character device. So let's look at upper bones, upper joints, lower joints. These also are done with numbers. Now it is divided into cervical, thoracic, and lumbar vertebrae, but then it's how many of those vertebrae are being treated. So you also have for ribs, upper bones, ribs 1 to 2, ribs 3 or more, not which rib, just how many ribs. In the upper joints, cervical, you have 1 vertebral joint or 2 or more joints. In thoracic, you have 1 joint or 2 to 7 or more than 8. In the lower joints, you have lumbar joint, and then you have 2 or more. So it's which area of the spine it is and how many joints are being treated. There are also special guidelines for tendons, ligaments, bursae, and fascia near a joint. So what you need to do is look at the procedure and see what was the focus of the procedure. What was the point? What were they trying to do? So here's an example, repair of anterior cruciate ligament of the knee. Code 2, knee, bursa, and ligaments, because the point of it was repair of the ligament. And the second one, knee arthroscopy with shaving of articular cartilage, that's a joint. So that would be coded in the lower joints of the knee, big articular cartilage up here. So what is the point? What are they trying to do? That's what determines which one of these body systems will be used. There are also guidelines concerning body systems for skin, subcutaneous tissue, and fascia over a joint. The shoulder is coded to the upper arm. The elbow is coded to the lower arm. This one is particularly important because, of course, it's right between the upper and lower arm, but the guidelines tell you it's the lower arm. The wrist is the lower arm. The hip is the upper leg. The knee, which again is right between, is the lower leg, and the ankle is the foot. So let's do another practice question. Pause the video if you wish. Left knee amputation, proximal tibia and fibula, 0, Y6. the first 3 digits. Anatomical regions, lower extremities, detachment. The body part character will be D, upper leg left, C, upper leg right, J, lower leg left, H, lower leg right. The guidelines state the knee is coded to the lower leg, and it says it's the left, so therefore the answer is J. Gastrointestinal system also includes some special guidelines or definitions. For the root operations, change, inspection, and removal, they include these body part values: upper intestinal tract, lower intestinal tract. So these are defined. The upper intestinal tract is from the esophagus down to and including the duodenum. The lower intestinal tract is from the jejunum down to the rectum and anus. And you see this line here that I drew in differentiates between upper and lower. So change of a device in the jejunum would be coded to lower intestinal tract. Bypass procedures. For bypass procedure, the body part character bypassed to or bypassed from is character 4. The body part area bypassed to is the qualifier character 7. So for example, open bypass from stomach to jejunum. This is stomach, body part, and this is jejunum. There's some important appendixes that are included in the PCS book related to body part values. In Appendix D, body part key includes the body part and the description used in PCS. Sometimes you won't have a body part that doesn't really fit. There's not a digit for it. You can look in the body part key and it will tell you where to look. If you look up ilium, it states you should use body part values pelvic bone right or pelvic bone left, whichever is appropriate. Appendix E is kind of a mirror image of body part. The body part key includes the body part value and the tissues included. So in this case, you look up pelvic bone and it tells you it's the ilium plus other things. In this one, you look up ilium and it tells you it's the pelvic bone. So you can go back and forth with these. Here's another practice. Refer to Appendix D body part key. If the documentation stated areola, the coder would use a body part for nipple, breast, chest, or skin. The answer is nipple, and that tells you in the body part key. So here's our final practice question. Refer to Appendix E body part definitions. Which tissues are included in the conduction mechanism? Appendix E will tell you that included in the conduction mechanism is the atrioventricular node, the bundle of His, the bundle of Kent, and the sinoatrial node. So there's no way you can remember all the guidelines in the PCS book. So here's some suggestions of things to write in your book, highlight, whatever works for you. In the tables for female reproductive system, note the differences between vagina, cul-de-sac, and vagina and cul-de-sac. Remember, this is an exception to the and/or rule. There's also uterus, cervix, and uterus and cervix. In the tables for male reproductive system, there's prostate, seminal vesicle, and prostate and seminal vesicle. Epididymis, spermatic cord, and epididymis and spermatic cord. So again, make a note of those. In the table for heart and great vessels, upper bones, upper and lower joints, note that you're using numbers, not names of body parts. In the tendons, ligaments, subcutaneous tissue, and fascia, make a note that you should report the code from the section that's the focus of the procedure. Is it on the bone? Is it on the joint? Is it on the ligament? In the skin, subcutaneous tissue, and fascia, write in those definitions. The shoulder is the upper arm, The knee is the lower arm, etc. In the gastrointestinal system, you can write in those definitions of the upper and lower tracts. That completes this video. If you have questions or comments, please feel free to contact me. I will be posting videos on characters 5 through 7 in the next few weeks. And again, here are the books I have written on coding. You can get these through this link, or you can just go into Amazon Books and type in my last name, Tropin. If you want to contact me, here's how to do so. I would love to hear from you. Thank you so much for listening. I hope to have more lessons up soon.